Today the subject is Hydrops Fetalis. Hydrops Fetalis. Hydrops means water or any liquid. Fetalis is fetus. So this is a very dangerous, life-threatening problem for the fetus or also for the newborn. So here what happens is the water is excessively accumulating in the body of the fetus and in the newborn. It's a very dangerous situation. So we will see the features one by one. Here actually this kind of a situation comes to the fetus around 1 in 2000 pregnancies. 1 in 2000 pregnancies or slightly lesser than that. And around 30% babies will die in the uterus. Die in uterus. So it's a very serious case. We can say this is a kind of edema in the fetus and the newborn. Edema means swelling. So how this swelling is happening and where it is happening, this has to be explained. So the features we will discuss one by one. First I have to tell you one term, anasarca. Anasarca. It's a new term for you. It's actually two words, ana and sarca. Ana means throughout or complete. Sarca means flesh. So in the fleshy area of the fetus, there will be water accumulation. Mostly this is swelling under the skin. We can say anasarca means general edema or general swelling of the body of the fetus. More technically, we will say it is subcutaneous edema. It means swelling under the skin throughout the body. Suppose This is the suppose this is the body of the fetus. Here we can see a general swelling all around the body of this fetus. So it will be like this, all swelling. All the body swelling. Ana means throughout the fleshy area. Mostly it is swelling under the skin. That means the skin will project outward this swelling we can see. General swelling. That is first case what we can see through the ultrasonography. We can see number 1, anasarca. Okay, 5 centimeters thickness all around the body. That is one of the main features of Hydrops Fetalis. Number 2 is Plural effusion. Pleura means what? Pleura is the covering of the lungs. Suppose this is the lungs. There is a covering for this lungs. That is what is called pleura. Pleural effusion. So this is the pleura. This is a cavity actually, a potential area. Serous fluid will come and accumulate in this cavity of the pleura. This is what is called pleural effusion. Effusion means accumulation of serous fluid. So that is number 2 symptom. Also we can see from the ultrasonography. Pleural effusion. Pleural cavity will be filled with serous fluid. It is also one of the major symptoms of Hydrops Fetalis. Number 3 is pericardial effusion. Pericardial effusion. What does it mean? Suppose this is the heart. For the heart, there is a covering called pericardium. The covering, outer covering of the heart. Peri means around. Cardial denotes heart. So this cavity is called pericardium. So when fluid accumulates in pericardium, we call it pericardial effusion. Effusion means accumulation of serous fluid. It is an important symptom of Hydrops Fetalis. Also can be noticed from the ultrasonography, ultrasound scanning. So this is pericardial effusion. This is pleural effusion. Then another one. This is ascites. Medically it is called ascites. What do you mean by ascites? Ascites means accumulation of fluid in the peritoneal cavity, that is in the abdomen. So this is peritoneal cavity filling of serous fluids. As it is medically known as ascites. In the peritoneal cavity, due to various reasons, ascites will be formed. It's a very common case in case of cirrhosis, and also in people taking too much drinks and all. So this is 4 important cases. This is peritoneal effusion, pericardial effusion, pleural effusion, and general swelling, anasarca. General swelling. This is anasarca. So these are some of the major symptoms or signs of Hydrops Fetalis. When we make a full diagnosis, doctors are very much keen in anasarca plus any one of these compartmental effusions. Anasarca plus any one of these pleural, pericardial or peritoneal cavity effusions. That is one condition. Otherwise, If all these three are coming, then also we can say it is Hydrops Fetalis. All the three. Sometimes certain scientists claim that only any two will give an indication of Hydrops Fetalis. But we can say in general, either anasarca plus any one, plural, pericardial or ascites, any one, or these three, plural, pericardial and ascites. In these two conditions we can confirm that it is Hydrops Fetalis. Now, there are 2-3 other compartments where also this serous fluid can be accumulated. One is, so that will be point number 5. Another condition is water accumulation in the brain area on the head. Hydrocephalus, it is called Hydrocephalus. Cephalus means brain, hydro means water. So water accumulation in the cephal area, in the brain area or in the head. This fluid is normally the cerebrospinal fluid. Cerebrospinal fluid. You know there are 4 ventricles in the brain which will produce cerebrospinal fluid, or we call it CSF, cerebrospinal fluid. Is overproduction of cerebrospinal fluid or some blockage in draining out this CSF. So that is hydrocephalus. That is also one of the symptoms for Hydrops Fetalis. Number 5, another condition, number 6, another condition is Hydrocele. What do you mean by Hydrocele? This is a situation that fluid is accumulating in the scrotum. This scrotum pouch, you know, our testicles are situated in the scrotum. It is something like a small bag in which testicles or testes, both the testicles are sitting in the scrotum. So if water is accumulating in that area, it is called hydrocele. That is in the scrotum. Accumulation of water in the scrotum. That also can be detected by ultrasonography. So all this will be clearly observed in ultrasound scan. Another point is that we can notice in Hydrops Fetalis is the ventricular septal defect in the heart. Ventricular septal defects in the septum. There may be sometimes a hole between the ventricles. That is a septal defect. It is also one of the features of Hydrops Fetalis, ventricular septal defect. Next is Thalassemia, especially alpha thalassemia. Thalassemia, it is a hemoglobin defect in some patients. There is alpha thalassemia and beta thalassemia. Here, alpha thalassemia is one of the features for Hydrops Fetalis. Then another feature is an enlarged spleen. Enlarged spleen. Spleen will be enlarged. We call it splenomegaly. Splenomegaly. Another symptom is the heart itself will be enlarged. The heart itself will be enlarged. So we can say enlarged heart. Also, sometimes the liver will also be enlarged. Enlarged liver. We call it hepatomegaly. Enlarged liver. It also is one of these features of Hydrops Fetalis. There is another peculiar feature for this kind of abnormality, that is, in the joints there will be very restricted movements. Suppose the elbow joint, We cannot extend or flex the elbow joint as we desire. So that is what we call arthrogryposis. It's a new term. Arthrogryposis. It's actually three terms. Arthro means joint, that you know. Gyrope means hooked or curved. The full shape is not formed. That is why it is in a curved shape. We cannot, say for example, this elbow joint, we cannot go to maximum extension or maximum flexion. That is, the movement is restricted. It is in the joint, so arthro. Grypo means it is something like a hook. It is hooked or restricted or curved. The movement is restricted. And osis means it's an abnormal condition. So there are three words: arthro, grypo, osis. Arthrogryposis. This can also be seen in the ultrasonography. Then of course, normally we can see anemia and jaundice. So jaundice in the newborn baby or in the fetus itself. Also anemia. So these are some of the major symptoms. Normally we can measure the middle cerebral artery and see how much is the flow velocity of the blood. That is also done by the ultrasound scanning. We all know that in the brain, the blood is supplied through two vertebral artery. It is joining and forming the basilar artery. So these are two vertebral arteries which is entering the cranial area. Then comes two internal carotid arteries. Suppose these two, the internal carotid arteries. This basilar will be joined to these internal carotid arteries, So one supply from vertebral artery, two vertebral arteries, two internal carotid arteries. From here there is posterior cerebral artery, and from here it is middle cerebral artery, then two more arteries, that is the anterior cerebral artery will also join. So this is middle central, this is posterior, and this is anterior. This is the posterior side, that means back side. Posterior means back, and this is anterior side. This is the middle cerebral artery. Middle cerebral artery. This is only a functional diagram. This is posterior cerebral artery, and this is anterior cerebral artery. And these are communications. So these are communicating arteries. So inside our brain there is an arrangement to get 100% supply of blood in all over the area. That is why this dual system. This is vertebral artery, and this one is our internal carotid artery. Two supplies, one from the vertebral artery and another from the internal carotid artery, and it forms something like a circle here. Both are joined and making with the communicating arteries. With the help of the communicating arteries, this is forming a circle. This is first explained by Willis. So it is called circle of Willis. Circle of Willis. By circle of Willis, we mean this arrangement. Suppose if there is some problem in one of the branches here, and this area will be supplied by the other branches. That is the idea. 100% sure that blood supply will be circulating without any problem all through the brain. This arrangement is called circle of Willis. Then why I am explaining this now here? Because there is a peculiarity for the fetus that the blood can be directed more to the brain area, because the fetus is very intelligent. Fetus knows that my brain requires always good flow of blood. So fetus, by its own property, it diverts a major quantity of blood to the brain. This happens whenever there is an anemia, or due to anemia whenever there is a hypoxia. So if there is not enough blood, or if the oxygen content is not enough to supply to all the areas or all the parts of the body, the fetus will just minimize the blood flow in other organs and give more blood to the brain. So through ultrasonography, we will get, or we can measure the speed of this area. It is middle cerebral artery. If we find that the speed of blood passing through this vessel is more than normal, that means the child has some hypoxic problem or some severe anemia problem. So they have made a chart like this, say gestational age 10 week, 20 week, 30 weeks, 34 weeks, it goes on like that. Weeks, gestational age. And here is the speed, say 10, 20, 30, 40 centimeters per second speed. Centimeters per second. And they have made a chart, something like that, which shows that in a particular gestational age, say for example 20 weeks, the speed should be something like that. So it's only an example. Like that, they have made a graph. So this graph will give you the average or the mean for a particular gestational age. For 30 weeks how much, for 34 weeks how much, it will give an idea. So this is the mean curve. Mean curve. And in the same, they have made another curves, for example, like this. This is a curve which is a multiple of this mean. Say, for example, this is 1.5 times of the mean for all these gestational weeks. So we can say this is a multiple of the mean. We call it MOM. Multiple of the mean. So there is certain values that we have to keep. For example, in a 34-week age fetus, the mean is this much, and if they observe the speed through the ultrasound scanning, if they find it is 1.5 times more, then they will say this is 1.5 multiple of mean. This is the use of this chart. There can be 1.2 multiple of mean here. So above 1.6 is supposed to be dangerous. So the principle is this: if the speed in this particular artery, middle cerebral artery, we will write here middle cerebral artery. They will check the velocity of blood here in this area. That is the peak systolic velocity. They will check peak systolic velocity of MCA. So this is the peak systolic velocity in centimeters per second in the middle cerebral artery. They will measure, and from that value they can make an assessment whether this fetus is suffering from Hydrops Fetalis. It is from the circle of Willis arrangement. I don't know the spelling of Willis is C or S. Okay. So that is circle of Willis and middle cerebral artery. Then another point we have to, is there any symptom of Hydrops Fetalis, any symptom or any sign in the body of the pregnant woman or the would-be mother? That is, so in the mother, point number 1, there will be excess quantity of amniotic fluid. We call this anomaly as polyhydramnios. Polyhydramnios. Poly means more or higher quantity. Hydramnio means amniotic fluid. So this anomaly is also considered as an indication that this pregnant woman is having a child with Hydrops Fetalis. For some doctors, this may not be a sure indication, but this also can be considered. Excessive quantity of amniotic fluid. It is medically termed as polyhydramnios. So in that case, we should have an idea what is the normal quantity of amniotic fluid. For example, let us see the case of, say, 34 weeks baby. Gestational age is 34 weeks. In 34 weeks, normally it is something like 800 milliliter of fluid present in the amniotic sac. If instead of this 800 if we measure in the 34th week gestational area, this one, actually the quantity of this amniotic fluid is slowly increasing week by week as the gestational age progresses till 34 weeks, and from there perhaps it may decrease a little bit. Anyway, for the average at this gestational age, we can consider 800 milliliters normal. Sometimes this is more than 2000 milliliters. Then we use this term polyhydramnios. That means more amniotic fluid than the normal. This case is a sign of a Hydrops Fetalis problem baby, which this pregnant lady is holding or carrying. Here in this context there will be another possibility that this quantity will be less than 500 milliliter. This also is not acceptable. So what is the name for this one? The lesser quantity. It is called oligohydramnios. Oligo means less or lesser in quantity. Oligohydramnios. So poly means high, oligo means less or few, quantity is less. It can be, when it comes to a number, we will say few. Here the quantity. So quantity is less than 500 milliliter. This is also a dangerous situation. So there are two terms. One is polyhydramnios, another term oligohydramnios. If it is more than 2000 milliliter, it is polyhydramnios. If it is less than 500 milliliter, it is oligohydramnios. Here our concern is polyhydramnios. It's a sign that we can observe in the mother. Another indication that we can find out from the mother is the size of the placenta will be large or thickened. This is what is called placentogmegaly. Megaly means big, enlarged. Placenta, it is relating to the placenta. So it is placentomegaly. Another point I have to mention along with this is the etiology for Hydrops Fetalis. What is the reason for this Hydrops Fetalis? Why it is happening? There are many reasons. I will just mention some of the etiology. So now we will come to the etiology or the reason for this Hydrops Fetalis. It's a very threatening situation. That is why we should know all the reasons also. First reason I can mention, it is the RH incompatibility of the blood group in mother and fetus. RH incompatibility, that is a rhesus factor. Especially the mother is RH negative and fetus is RH positive. Then there will be formation of antibodies in the mother's blood. Then that will attack the fetal blood, causing hemolytic disease of the fetus and the newborn. ABO group incompatibility also can contribute little. ABO incompatibility can also cause a little. So this both are known as immune related reason, because it's all because of the antibody formation by the immune system. So both these are immune related problems. We can say hemolytic disease HDN, hemolytic disease of the newborn or the fetus, or hemolytic disease of fetus and newborn, HDFN or HDN. So both these are immune related reasons for the Hydrops Fetalis. Then there are some chromosome related problems. What are they? Number one is in chromosome number 23. Normally, in 23, two sex chromosomes will be there, for male 2 and for female 2. Here what happens is, in the 23rd chromosome for the female, instead of 2 chromosomes like this, there is only 1 chromosome in the 23rd pair of the female fetus. This anomaly is called Turner syndrome. Turner syndrome. Here what happens is, totally this patient will have only 45 chromosomes, because in the 23rd pair there is only 1. Sometimes it is written as 45 X and 1 will be 0. There is nothing. Sometimes it is written like that also. 45X0. That means this is supposed to be the 46th chromosome, but it is not available. It is called Turner syndrome. Chromosome 46 is absent. Number 46 chromosome is absent in females. It should be actually XX. Instead of that, it is X0 in the female. Turner syndrome. Sometimes this is called monosomy. Monosomy in 23. Somy means body, this chromosome body. Mono means 1. Here in the 23rd pair there is only 1 chromosome, that is monosomy. That is Turner syndrome. Monosomy in 23 in the female. Another case is in chromosome 21. I think that you all know. In chromosome number 21, there are 3 chromosomes instead of 2. In 21, instead of 2, there are 3. So this is trisomy. Trisomy in 21. This is called trisomy in 21, and this anomaly is called Down syndrome. Down syndrome. The child will be having some deformities, also mentally retarded, and some heart problems also will be there, and many problems. Down syndrome. That is in chromosome number 21. So when we examine this cell of this Hydrops Fetalis child, we can see sometimes this kind of abnormalities. Another chromosome abnormality is in number 13. Chromosome number 13. This is also trisomy. Trisomy in 13. Chromosome number 13. This is called Pata syndrome. PATAU, Patas syndrome. The baby will have problems, mental retardation, and some other problems also, like trisomy 21. There is another trisomy also. That is what is called trisomy 18. So chromosome number 18 also 3 chromosomes in number, that is trisomy in 18 it is called, and that the name of that anomaly is Edwards syndrome. Edwards syndrome. So these are all known in the names of those people who discovered all these anomalies. Then another point I have to mention here is a normal observation case. That is, if say as a next case, if Hydrops Fetalis is noticed, if Hydrops Fetalis is noticed before 24 weeks, before 24 weeks, we have to consider this the problem. We have to consider the problem as a chromosomal problem. If it is found in a baby less than the gestational age 24 weeks, this will be a chromosomal problem. Similarly, if Hydrops Fetalis is noticed after 24 weeks, after 24 weeks, we can say this is a structural problem. So the problem can be chromosomal if it is noticed before 24 weeks. And if it is noticed after 24 weeks, then there will be definitely some structural problems for the baby. Then we have to come back into the etiology again. Another point I have to mention here is, suppose the liver is not producing enough albumin. We know in the blood there is albumin, one protein. Albumin is produced by liver. The main function of this albumin is to maintain osmotic pressure in the blood vessels, especially in the capillary area. If there is not enough quantity of albumin in the blood vessels in the capillary area, the system cannot hold enough water inside the vessel. The water will be leaked out. For example, suppose this is the blood vessel and this is the cell. Here there will be albumin. Normally the water will come out to the interstitial space here, water, and that water will go to the cell if it is necessary. Then water can come out also, or another fluid can come out, and it is going back to the vessel. This is the normal arrangement. This space between the blood vessel and the cell is called interstitial space. This fluid from the interstitial space is drawn inside the blood vessels by the osmotic pressure of the albumin. So if there is no albumin present here, not enough quantity, water will be accumulated here. So much water will be here. So that is the reason for the swelling. So swelling or edema means it is too much water in the interstitial space. Whatever water particle coming out is not taken back, because in order to take it back, enough protein or albumin should be here, and it is produced by liver. Suppose liver has some problem, then it will not produce enough albumin. If enough albumin is not here, it cannot draw back the water particles from the interstitial space. Then water will accumulate and swelling will happen. That's the mechanism in the capillary. So that means if there is any liver problem, Hydrops Fetalis can occur. Also in the capillary system, it depends on the permeability of this blood vessel wall and the normal hydrostatic pressure, and there should not be any blockage in the lymphatic system. These are all some of the reasons for Hydrops Fetalis. Number 1 is liver problem. Number 2, low hydrostatic pressure. Number 3, high permeability of this blood vessel wall. Then low lymphatic drainage. These are all some of the points we have to take care. Now I have to give you another point, that is the infection. If the fetus is infected from the mother's side, that can happen, infection. Some bacteria and virus that can pass the placenta and enter in the circulation of the fetal body. This is medically called by a popular term TORCH, TORCH. It's an abbreviation for T means toxoplasmosis. There is a protozoa called toxoplasma. It is slightly curved in shape like this. Toxo means curved. Plasma here means formation. So here the protozoa, which is curved in shape, toxo means curved, plasma means formation or shape. So it is, this protozoa is called toxoplasma. It is usually found in cat. So we have to take care when we play with our pets. This is actually found in North America in some particular rodents. That is why this particular protozoa is called Toxoplasma gondii, Gondii. Gondii is a rodent, a rat-like animal found in North America. So this particular protozoa is first identified in Gondii animal. This is a rodent. So this is sometimes called Toxoplasma gondii disease. it is due to that particular protozoa. So we have to take care when we play with the cat. Then this R means rubella. What is rubella? Rubella is German measles. German measles is called rubella. Too much patches will appear in the skin of the infants, and also fever, headache and all. So this is called rubella. Then this C is called cytomegalovirus. Cytomegalovirus or CMV, cytomegalovirus. This virus is normally making some of our epithelial cells large. So cyto means cell, megalo means large. So this virus will make some cells large. That means it will enlarge certain epithelial cells. That is why it's named like this. Cyte means cell, megalo means big. So this virus will make some cells megalo, big and large. That is why it's named cytomegalovirus. If you understand the meaning of the words, it is very easy to follow medical subjects. And this H means herpes family. This is also a creeping type problems appearing in the skin. Herpes. Herpes means creeping. That is why it is called herpes. And now here one letter is also to be considered. TO. What is TO? T, toxoplasmosis, rubella, cytomegalovirus, herpes. Now for O means others. Others means what? Which diseases? Number 1 is parvovirus. Parvovirus B19. Parvo means small. It is a very, very small virus, say around 25 nanometer size. Very, very small. B19 type. It is causing very severe anemia. This is sometimes called fifth disease. the disease caused by this parvovirus, fifth disease. Why it is called fifth disease? Because in earlier days they were classifying the diseases caused by these general problems in the infants and the skin, rashes, along with runny nose and all. They classified this disease in an order, and they put, along with their names, they put a number also. So the first one, they put the name measles. Second one, they put number 2 as Scarlet Fever. Scarlet Fever. Scarlet means something like strawberry color. So in the tongue there will appear a scarlet color. That is why it is called Scarlet Fever. Then 3 is rubella. As you know, it is German measles. Then 4th disease, they call it Duke's disease. 4th disease is Duke's disease. 5th disease is parvovirus disease, B19 type. Then there will be 6th disease also, that is Rosciola. Why it is Rosciola? It is in the shape of rose. That is, in the color of rose. That is why Rosciola, rose color. So they used to call disease number 1, number 2, number 3, number 4, number 5 and number 6. On those days they used to call by number also. So 5th disease here is parvovirus. So they call it 5th disease. It is another name for parvovirus B9. Similarly, disease number 1, if they say, that means it is measles. That is a naming pattern. So what I was explaining is parvovirus. So it is called also 5th disease. 5th disease, because it is 5th in this order. That is parvovirus. It's very small. Parvo means very, very small. Then there is varicella. The full name is varicella zoster. Zoster means belt. Shingles it will be formed in the belt shape. That is why it is called varicella. It is actually, varicella is formed in the name of, this is the name of chicken pox. So varicella means the disease of chicken pox. Then also there is adenovirus that can also cross the placenta and reach the baby.